Hi, everyone. My name is Nidar Raslan. Thank you so much for having me on this panel. I'm a Kawasaki mom. My son had Kawasaki disease in 2008 when he was 7 years and 3 months. And now I've joined the Kawasaki Disease Foundation in Australia, maybe about 2 years after that happened. And now I'm the parent support coordinator for the Kawasaki Disease Foundation in South Australia. Our story started off with the usual, like temperature. Temperature wouldn't go down for 3, 4 days, 5 days. Went to first doctor, said it could be a viral infection. Came back home. Uh, it developed to tummy pain and a headache. Went to the hospital and they said, "Oh, that could be." They took a swab. They thought it was a streptococcus. But it was negative. And then I took him back to another doctor, said, "Oh, keep doing what you're doing. He's okay. It's only a virus." I'm just telling you briefly because I noticed that we don't have much time. So at last, he had a swollen glands and he had a swollen scrotum. And that's when I called an ambulance and went down to the hospital. And I was furious then because I've been twice to the hospital and they sent me back home. So a surgeon came and saw him that day and he said, "Oh, we have to perform a procedure to see whether his testicles are twisted because it does look really abnormal." And that's what happened the following day. 3 days in the medical ward with antibiotic, intravenous antibiotic. His temperature wouldn't go down. So the surgical team has referred us to the medical team then, and still temperature is spiking up all the time. Uh, uh, they did all the blood culture, blood test, bone scan, chest X-rays, all the tests that they can do to eliminate stuff, and they wouldn't know what was going on. By the time that happened, we were on day maybe 14. A senior doctor came and spoke to us. His name was Dr. Pearson. And he said to me, "Look, Mrs. Raslan, we really don't know what's going on. It's a puzzle, to be honest with you. But I'm considering maybe it could be Kawasaki disease." And I have never, ever heard of it. And he said, "We want to do an ultrasound for the heart." And I thought, okay, what's wrong with his heart? I'm sure there's nothing wrong with his heart. They just don't know what they're doing. Like, I was so frustrated. So we went down to the ultrasound room. They did the ultrasound, and a senior cardiologist came and spoke to me. And he said there is some inflammation in the coronary arteries. They look like a bit swollen, a bit like a cigar shape. And just to be safe, we want to give him a medication called um, uh, immunogammaglobulin. So on day 14, he had his that day he was so irritable. Some other symptoms have come up, like the strawberry tongue and the cracked lip and the red bloodshot eyes as well. And his temperature went down that day, that night. Around 2 o'clock, 3 o'clock in the morning, temperature spiked back up again, and he started peeling, like the hand and the feet start peeling. So they decided to give him another round of immunogammaglobulin, which worked for maybe uh, 24 to 30 hours maximum. They sent us home then. By the time we got home, he got temperature. So we went back down to the hospital, and that's where the immunology team start working on him, the rheumatology team, sorry, the rheumatology team. So we had the medical team, the cardiology team, and the rheumatology team. The three of the teams were working on him, and they decided to give some kind of steroid, which made him miserable as well. He had like puffy cheeks. He was eating 24/7, and he wasn't well at all, and his temperature didn't go down. So to make the story a little bit short, They did another ultrasound for the heart. They found that the right coronary artery has a giant aneurysms in it, one giant aneurysm, which is 9 millimeters, I think it was. And on the left coronary arteries, he had 3 aneurysms, one 5.2, the other one was 3.1, and the descendant one at the end was 2.1, something like that. So, and that's how our journey started with Kawasaki. Then the rheumatologist at the end of it, that was 6 weeks on, decided to give him an adult medication called Infliximab, and we had to sign paperwork for it to see that we agreed to it, and she had to ask the medical board to be able to use it, and it had so many like side effects. He could have an anaphylactic shock, he could have a heart attack, you name it. So we were really, it was really the hardest time of our life, to be honest with you. And they did give him the infliximab. Of course, they gave him the warfarin and the aspirin, and they were doing blood tests every morning and every night to see his level with the warfarin. He was bruising easily, and it was really, really hard and tough, to be honest with you. When they administered the infliximab, they actually, it shows the time of the day where the whole nursing team is in the ward, and they put us next to the nursing station. They informed the ICU if he had any, side effects, so the ICU is going to be ready for him. And they did give him that medication, and we had to wait. He didn't have any side effects. The following day, they did a blood test at 7 o'clock in the morning, and at around maybe 9:30, the rheumatologist came back with the result. His CRP in the blood before the infliximab was 300. And after the infliximab, it went down to 4. And it was a miracle, to be honest with you, because I don't know how that happened. 6 weeks on, and that miracle doctor and medicine did the trick. And since then, he's been doing stress tests every 6 months. He's been doing, sometimes they do an angiogram as well. He wasn't allowed to play any contact sport or anything like that before, but now he's actually playing soccer and for our community team, and he's at the gym and he's doing bodybuilding. But the last angiogram showed that he has blockage to his right coronary artery for about 75%. And the doctors, they did like a team of cardiologists meeting to see whether they can stent it or maybe decide on an open heart. They went against the stenting. They said it's too long. There is no stent that goes, from one side to the other that big. Like different opinions, to be honest. I was recently in Lebanon, and I went and saw 3 cardiologists in Lebanon, and I took his results with me, and I did send the result to Dr. Najib as well. And everybody gave us different opinions. So we still in the unknowing, to be honest. They don't know to decide what to do with him at the moment. But he's doing fine. There is no symptoms. He's going strong, and now he's 23 years old, and he's doing his PhD on quantum physics at uni. So he's really done marvelous.
Nidar, thank you very much.
Thank you. Thank you.
Yeah, please trust us. The coronary problems in the adults is really what we try to solve slowly, but certainly at the International Kawasaki Disease Society. And Kawarabi is certainly part of this big society. So please bear with us. We continue to take it one case at a time. Every single patient is different from everybody else. It's certainly different from the adult typical coronary artery disease. But we're getting there, and we have solutions.
Yes, I hope so. Thank you
Thank you.
so much, Dr. Najib. That gives
Very
me
well.
hope
Good.
that
Thank you for
it's
the
gonna.
testimonials. This is very precious. Please stay with
Thank
us. You
you.
are welcome
I
to
will.
attend the whole day today and the whole day
All right.
tomorrow. Please ask other families as well. We
Thank you.
will
Thank
thank
you so
you,
much
Dr.
for
Fadal
listening
Ahmadi,
as
very
well.
much